overnight, they passed the single largest transfer of wealth from the poor to the rich in the history of our country. Now, reading their big, beautiful bill, you realize pretty quickly why they did this in the dead of night. At least 7.6 million people losing Medicaid coverage, millions more losing their health care coverage and seeing their costs go up, students having their Pell Grants cut, the biggest cut to SNAP in our history. Why? All to help fuel up those corporate jets and executive bonuses with tax cuts for billionaires. Now, the bad news for Republicans is we are not going to let them keep the American people in the dark about what is in this legislation. We're going to put a big, bright, burning spotlight on this awful disaster of a bill. The legislation Republicans are pushing through Congress is the largest cut to Medicaid in American history. That is stunning. Here in Washington State, we are looking at least 194,000 people losing their Apple Health coverage under that bill. And that number rises to 250,000 people in our state getting kicked off their health care if you include all the ways that Republicans are sabotaging the ACA in this bill and letting important health care tax credits for the middle class expire. Under this Republican bill, Washington State would lose an estimated $2 billion in federal Medicaid funding over the next 4 years. That would be catastrophic for our state budget. And on top of that, Republicans' bill would defund Planned Parenthood. That's a longtime goal of the anti-abortion extremists, and it would be absolutely devastating for women's health care in our state and across the country. Defunding Planned Parenthood would put 200 health centers at risk of closure across the country and put critical cancer screenings and birth control even more out of reach for many women. And by the way, it would actually cost taxpayer money, $300 million over the next decade, according to nonpartisan estimates. Altogether, the health care cuts in the Republicans' mega bill will mean hospitals and nursing homes shutting down, especially in our rural areas. Millions of people getting kicked off Medicaid or their coverage under the Affordable Care Act. People blocked from accessing the benefits they are rightly eligible for because of a new wall of paperwork and red tape. Planned Parenthood health centers closing their doors. Kids with disabilities losing out on the care that they need, and medical debt skyrocketing, and insurers leaving the marketplace, leaving our families and small business owners with little or no options for health care. Needless to say, all of that means higher costs and less access to care for everyone, not just people on Medicaid. But I have to say, for the life of me, I do not understand how some of the same Republicans who represent areas of our state, the most reliant on Medicaid ever, looked at this bill, looked at what it would do to the people they serve, and said, count me in. Now, it is worth noting that House Republicans did make some last-minute changes, but not what we might expect. In the middle of the night, they added language that made sure people lose their health care sooner. And they made sure it would be more expensive to get health care coverage on our exchanges. And they did silly things like getting rid of the tax gun on silencers when they thought no one would notice. Now, meanwhile, people at the very top in our country, the billionaires, biggest corporations, they're doing fine. They don't need to be showered with money taken out of the pockets of struggling families. And you know what? We really want to help American businesses, then we should pass legislation to stop Trump's trade war, which is hurting businesses and driving up our costs. That sounds much better than taking food from hungry kids to give Elon Musk another tax break. That makes more sense than kicking seniors out of nursing homes. Wow. And it seems more reasonable than cutting patients off from their health care. This is not complicated. Republicans want to pass a bill that will hurt our middle class and working families and give a handout to some of the richest companies on the planet. Republicans know this is bad policy. They know it is massively unpopular. They know they are adding trillions to the national debt, which is why They're trying to jam this through with as little scrutiny as possible. But we are putting this heist on full blast and fighting back against it with everything we've got. Remember, we managed to stop Trump and the Republicans from repealing the Affordable Care Act back in 2017. So my message to everyone right now is the time to get loud, speak out, talk to your friends and family, especially in Republican districts, call your members of Congress, and just remember you are not powerless. Public outcry matters. We have seen that even in this administration. They are not totally immune from public pressure. But we need to show Republicans the American people are watching, and they have to answer to their constituents. Very happy to be here today with my great colleague, Senator Cantwell, and a number of people who will be impacted and the patients that they serve by this bill. Start with Senator Cantwell.
Thank you, Senator Murray, and it's great to be here at CMAR with Dr. Jose Anines, Edna Cortez, who is going to speak about children's health, also Britta Lund, Rachel Nemhauser, who is a parent with her son, and so glad that I can join all of them today on this important occasion. I think Senator Murray said it. This is an attempt to roll back the Affordable Care Act. This is an attempt by people who have passed this bill over to the United States Senate to try to say that Medicaid is somehow worth cutting when we know it has been essential service like here at CMAR. We cannot kick 270+ thousand Washingtonians off of Medicaid when we know that our expansion under the Affordable Care Act and our support for clinics like CMAR is what helps stabilize our cost of care. It drove down by 1/3 the cost of uncompensated care, and it got more people coverage, so we had our lowest rate of uninsured in our country's history. My colleagues in the House of Representatives who passed this legislation are trying to throw that away. They're trying to literally roll back the Affordable Care Act and say that if you basically kick people off of Medicaid somehow, that is going to help all of us. It just goes to growing, again, the cost of uncompensated care, seeing people without getting compensated, and making clinics like here at CMAR that we just saw upstairs, their children's unit, and dealing with the health and stability of children. How would anybody want CMAR's child clinic to have less care? And so what we're really saying today is that we do have to fight back, just as we did when they tried to block grant Medicaid and confuse the American people. This is just another attempt to try to say that this is some idea of efficiency, when in reality, all of our costs are going to go up. I know this is true because many of our Republican colleagues here in Washington state also sent us a letter saying the same thing. Members of our state House of Representatives and legislators and some other state Republican officials said that they knew that Medicaid costs would not save money, but they will just take a hammer to our healthcare system. And these Republican leaders said, quote, Washington state will be one of the most hard-hit states with Medicaid losses, unquote. So I know the people here in Washington who have to deal with this issue, who know that their rural hospitals could go under, or their health clinics could be affected, or the cost of care could go up in their communities and make everything more expensive. They know that we also have to stop this legislation. We need to say to the President of the United States, he has to stop trying to dismantle the Affordable Care Act. He cannot propose ideas that literally will leave these providers without resources. And as Senator Murray mentioned, the other tweaks to the bill literally are trying to tie the state's hands in any way of getting compensation. So providers literally are being limited in their choices. Our state, because we did have one of the largest expansions of the Affordable Care Act, are now 1.9 million people being impacted by the Medicaid budget. So we do not want to cut reimbursements to providers. We do not want to cut critical services like mental health. We do not want to cut fentanyl treatment or reproductive care. And we don't want to cut more people off of Medicaid. Now, I'm glad Planned Parenthood is here too, because the House bill would bar Medicaid recipients from receiving any care at Planned Parenthood. I would ask my colleagues if they understand that Planned Parenthood is sometimes the only care for miles and miles and miles and miles and miles. And that means young women not getting access to reproductive care or even something as simple as a health care checkup, just because our colleagues want to cut people off of Medicaid. So, we do not need to have Robin Hood in reverse. We do not need to steal from Medicaid the stability of our healthcare system and give a tax break to big corporations. We need to stop this effort as soon as possible. Senator Murray and I will be fighting every day on the Senate floor to convince our colleagues that this is not only a wrong-headed approach, it is going to cost the American people something we can't afford, but we can afford fighting for the Affordable Care Act. Thank you. And now I'd like to turn it over to Dr. Inez and thank him for allowing us to be here at CMAR today.
Thank you. Senators, thank you. So my name is Jesus Iniguez. I am a family physician at CMAR. I've been practicing for the last 5 years. I did a surgical obstetrics and I do broad spectrum family medicine. I care for every single patient that walks through the door. It doesn't matter if they're Republican. It doesn't matter if they're white, black, Latino. I care for everyone. And sometimes that care is harder because of the system that we put in place. And I think everyone has to access health care at some point. Everyone. And whether you're on the good side of a good day or on the bad side, you get lost from your job, you have uncoordinated care because of your health insurance lapses, we will care for you. If you walk through the door, we will care for you. But if we choose to put in place policies that make it harder for us to care, it hurts everyone that walks through the door, not just the uninsured. There are statistics on uninsured patients. They die quicker, they are sicker when they access care, and instead of paying $10 to get diabetic medications, we have to pay $10,000 for a foot amputation. And where does that leave us as a society? Where does that leave us? It leaves us with people who are sicker, who are more depressed, more anxious, who can't work, and what happens to their families? And we have a decision to make. If we don't make that decision, we will still shoulder the burden. The primary care team here in Washington, the 8,000 family physicians that I'm representing right now, we will shoulder the burden. But for how long? How much longer? And so I just plead everyone who has the ability to speak about this, please help us prevent this from happening. Thank you.
Thank you, Dr. Jesus. Thank you. Thank you, Senators Murray and Cantwell, for the opportunity to speak here. My name is Edna Cortez, and I have been a pediatric nurse for over 35 years. I've worked in various areas at Seattle Children's Hospital and currently serve on the board of directors for the Washington State Nurse Association. As a nurse who has worked with children and families for decades, I can tell you this proposed cut would be devastating to thousands of families in Washington. I've seen firsthand how Medicaid is critical, whether or not these children, along with the support of their caregivers and families, because nursing is holistic care. These individuals receive the life-saving care they need, and without it, I cannot imagine what can happen. We, the nurses, are present at every level of care delivery, whether from birth to our sick and dying. We are the front lines and must deal with the consequences when patients avoid care because of lack of coverage. These cuts are not only cruel, they are harmful to the stability of our entire healthcare system. The system then becomes cyclic, which means the patient and their families need to go back from the very beginning to start care. Right now, more than 2 million Washingtonians rely on Medicaid, and over 800,000 of them are children. How are they going to cut access to critical life-saving care to these children, and to do it for more tax cuts for the wealthy. Where are their values for our nation and our families and our kids and families? I would like to share one story which I may get a little teary. So I have been a pediatric nurse, flight nurse and ICU nurse for many years, and I would like to share this story. My first patient, and I'm going to go by the initials of BP, had this debilitating medical disorder as a young child. He was transported from Idaho via medical transport, and I was one of his flight team. His diagnosis took a couple weeks to diagnose, and eventually his organs were failing and needed to go on life support, which is called ECMO, which is extracorporeal membrane oxygenation. He survived with constant care, weeks of rehabilitation from the medical teams and nursing staff. And I am proud to say, a couple years ago, I attended his high school graduation in Idaho, and it's a small town in Idaho, and the entire town called me Nurse Edna, which is a proud moment to me because of Medicaid and all the care that we had given to my kiddo makes me very proud. Now imagine if BP could not access any of this life-saving care, which was over $500,000 a year, more than a year, for a tax cut for the wealthy. This is not right, especially for my kiddos. These cuts will not only impact those who are on Medicaid, but we will all feel it, and we will all. The ripple effect is something monumental, but as I had said earlier, it is not just a ripple effect, it is cyclic. And reducing care for the millions is unacceptable. Like I had previously said, healthcare can be cyclic. Patients and families should not have to decide whether or not to have food and essentials versus healthcare to live. What we do in this moment as a nation and what our members of Congress do on behalf of those they are elected to serve will define who we are now and for future generations. The public and society overwhelmingly trust nurses. And as you all know, nurses are the most trusted profession in this nation, and I'm going to say the most trusted profession in the world. So we ask that we trust. Now we raise alarm over these devastating cuts to Medicaid. We must support Senators Murray and Cantwell in their fight in the Senate to push these efforts back. This is not who we are. We do not let hundreds of thousands of people, and especially the kiddos that I take care of, suffer or worse so that the rich can enjoy a very large tax break. Thank you for allowing me to speak, and I hand over the mic to Britta from Planned Parenthood. Thank you.
Thank you, Senator Murray and Senator Cantwell, for drawing attention to this important issue. My name is Britta Lund. I'm the Northgate Health Center manager for Planned Parenthood here in Washington. If this bill that passed the U.S. House last week becomes law, it will be one of the most devastating attacks on healthcare access in American history. By banning Planned Parenthood from seeing Medicaid patients, the bill targets our organization and the patients who rely on us for care every day. The people who passed this bill wish for Planned Parenthood health centers to close their doors and for people to lose access to affordable health care, and for many, access to health care altogether. And if this bill becomes law, their unbelievably cruel wish will be granted. Health centers will close, maybe even here in Washington. Planned Parenthood Federation of America estimates that 200 health centers will close nationwide. 90% of those are in states like Washington, where abortion is still legal. As you've heard today, people will lose their insurance coverage through cuts to Medicaid and the Affordable Care Act. Nearly 40% of our patients at my affiliate here in Western Washington are Medicaid patients. This is about so much more than abortion, which already cannot be covered by federal Medicaid dollars. This money goes to birth control, it goes to cancer screenings, STI testing, all of which are now at risk. Every single day at the health center that I manage in Northgate in Seattle, we help people sign up for Apple Health and Medicaid. Not just help them access our services, but we ask them a few screening questions and then show them how to enroll in the program. Because when they walked through our doors, they didn't have any insurance. And many did not even know that it was an available option to them. One of our front desk receptionists, her name is Mary, is the longest tenured employee in our Planned Parenthood affiliate and might be the longest tenured employee of Planned Parenthood in the state. She estimates that she personally enrolls 1 to 3 patients per workday. Over her career of 36 years so far, that means she has enrolled around 1,800 people. And that's just Mary. There are providers and staff like her at every Planned Parenthood health center in the country and at places like CMAR who help patients sign up for Medicaid because everyone deserves to get the care that they need, no matter what. If this bill does become law, hospitals will close, clinics will close, long-term care facilities will close, and everyone, not just Medicaid recipients, will be punished. People will have worse health outcomes. People will die of preventable illnesses. Those of us working in healthcare have one common goal: to help people. I often remind my friends and colleagues that everyone loves somebody who's had an abortion, and some folks have a hard time grasping that reality. I should not have to convince you that everyone loves someone who has tried to access healthcare services in their life. You can change whatever laws you want, but you cannot change the fact that everyone needs care. Thank you for your time. And now I'm going to turn it over to Rachel.
Hi. My name is Rachel Nemhauser, and I am so honored to be here today with my son, Nate, who is one of almost 280,000 adults with disabilities enrolled on Medicaid in Washington. With Nate's permission, I wanted to take a few minutes to just tell you a little bit about him. Nate is 20 years old and autistic. He has an intellectual disability, and he requires home and community-based waiver services and support throughout the day to ensure all of his needs are met. He's a major prankster. He's a horror movie fan, and he is the proud owner of not one, but 2 life-size Chucky dolls. Nate has a job at our local neighborhood Pagliacci Pizza, where he works 4 hours a week folding pizza boxes and doing other odd jobs around the store with the support of a job coach. He, of course, gets a paycheck for his work, but he also gets a free slice of pizza and a soda after every shift, which is... yeah, the best. He adores his job, and he is so proud of the ways he contributes to his community. Nate has dreams for his future. When school ends next year, he wants to move into an apartment with his girlfriend. He wants to work more hours at Pagliacci. He wants to eat pizza every day, and he wants to own at least 1 cat. He talks about wanting a home and a family of his own, and he yearns to have the same freedoms and independence that other adults have. Building the life of his dreams and filling his days with enrichment and social connection is not easy when school ends. But with the help of Medicaid services the way they are now, Medicaid services such as health insurance, employment support, personal care, and home and community-based waiver services, we're starting to see a pathway forward for him. It's a steep one, but the pathway's there. But if the proposed Medicaid cuts go through, this dream vanishes. iPad in a minute. Nate's ability to hold a job, his ability to engage in the community, and his ability to live a life of his choosing, it just disappears. What's he doing behind my back? His ability to feel the pride of being solely responsible for the pizza box needs of his neighborhood, gone. His ability to imagine what name he'll give his future cat. His ability to make his own rules in his own house about how much pizza a person can eat in a day. To many of us, these are trivial freedoms that we take for granted, but for Nate and the other almost 280,000 people who are enrolled on Medicaid, these potential cuts to Medicaid threaten to eliminate those choices. It threatens to reduce or eliminate the job support he counts on, making it impossible for him to stay employed. It threatens to reduce his access to health care, making it really difficult for him to stay healthy and to continue to work. It threatens to create paperwork and administrative barriers that are so burdensome and complicated, as Nate's mom, I can tell you, that it's almost impossible not to make a mistake once in a while. It is absolutely devastating to think that a singular vote from a group of people who don't know us and don't fully understand the terrifying impact of losing Medicaid could take this all away from him, all in the name of reducing waste. But here's what I want you to know. Nate is not a waste. His needs, his dreams, and his plans are not a waste. His career and his ability to contribute to his community are not a waste. He is a human being with hopes and talents and a right to a full life. Medicaid pays for the supports that makes Nate's life and his dreams possible. These are not luxuries. These are the tools that allow him to be a part of the world around him. For Nate, Medicaid brings freedom, and cuts to Medicaid eliminate those freedoms. Please save Medicaid. Nate deserves the help and the support required to make his dreams come true. His future and the future of hundreds of thousands of other disabled adults depend on it. Thank you.
Thank you.
The fiscal calculation here, as Dr. Negus alluded to, losing access to care also has a fiscal impact down the line. And if you've had those conversations with your Republican colleagues,